I'm doing my presentation on post-traumatic stress disorder. Post-traumatic stress disorder is considered a mental health disorder. You usually get it by witnessing or experiencing some type of trauma. But not everyone who experiences trauma will develop PTSD. The most common types of trauma that result in PTSD are military or combat trauma, witnessing or being involved in a life-threatening car accident, sexual assault or physical abuse, and serious health concerns that lead people to the ICU where they're intubated and undergo a lot of treatments. And in recent years, they have found that incarceration leads to post-traumatic stress disorder as well. And some of the signs and symptoms are flashbacks and nightmares of the like reliving the trauma. There are also physical signs that are tremors, pain, sickness, any kind of physical ailment that is linked to that. And then avoidance. A lot of times they will avoid people or places that remind them of the trauma. They avoid talking about it frequently. And then hyperarousal, and this is defined as an overall edgy feeling. They can have a lot of anger and just kind of have angry outbursts. And then with rape, feelings of guilt are often seen with that. So the size of the population. Um, PTSD is a concern nationally. It can affect 7 to 8% of the population. 10% are women, 4% are men. So 1 in every 13 people and 1 in every 3 people who have trauma develop post-traumatic stress disorder. In children and adolescents, it's 3 to 15% of girls and 1 to 6% boys. And with the military, they found that in Iraq, 11 to 20% developed it. In the Gulf War, 12%, and Vietnam was 30%. One of the reasons they stated that Vietnam was higher was how they were perceived when they returned and when they came home. So some of the contributing factors, the social determinant of health. So the biggest, there are many concerns with post-traumatic stress disorder. One of the biggest ones is social or community support. They don't often have a lot of family or friends support. They don't like to talk about it, and it's sometimes hard for them to make appointments, and so they don't seek out a lot of community resources. So they have a lack of healthcare access and quality, so they don't often attend doctor's appointments or appointments for psychotherapy like cognitive therapy or to get treatment for the condition. And then they do have some economic instability in that it's hard for them to go to a job consistently, and so that can affect their ability to have healthy food and housing at times. So some other specific concerns, the biggest concern with post-traumatic stress disorder is going to be safety. Um, they have a high rate of suicide and a high rate of substance abuse, both alcohol and drugs. And that can cause a lot of problems and add to a lot of violent episodes. And like I stated in the other slide, just a lack of taking care of their physical needs. They have a hard time with job security, and so that makes it hard to be able to provide for their own needs, getting adequate food, water, housing. They also lack adequate sleep at times due to the flashbacks and things like that. And so that can be a concern for them as well. So our root cause. So the root cause of post-traumatic stress disorder is not seeking help. A lot of times with this disorder, there's a lot of stigma around it, especially in the military. They stated that in a lot of military individuals, they fear coming forward because of a lack of being declared fit for duty, feeling like they could harm their careers, and a lot of other reasons that they may not seek help. And then there's also a financial burden. Treatments can be expensive, and if they're not able to hold down a regular job and have insurance to help with that, that could make it difficult. And something that I found interesting is the time of treatment. It can take years to be stabilized to enough where you don't have to have frequent treatment with it. They stated that in non-combat trauma, it can be up to 6 years, and in combat trauma, it is usually an average of over 13 and can go on even longer than that. So this lack of seeking help causes them to not have access to mental health providers that could help with their situation. So in the contributing factors of the Maslows, so one of the things that they are able to meet is just their basic physiological needs. So that is breathing, air, for the most part, they can have food access. And so that's one that they usually can meet. Most of the others are unmet, starting with the safety. So they're not usually able to keep a really steady job. Some can work, but just not real consistently. Their health is affected. So not being able to meet those needs leads to not being able to meet the love and belonging. They have a hard time with relationships, especially with sexual trauma can be very difficult for intimate relationships as well. So that can lead to having a lack of that confidence and a lack of respect of themselves and things like that. And then that can lead to not being able to have that self-actualization as well. So the ability to problem solve, acceptance of facts can be a difficult thing. So as you can see with this, that you're not able to meet those basic needs, then it's harder to meet any of the others. So their functional level would be limited. They can basically care for their very basic needs, food, in most situations, air, breathing, things like that, but nothing really beyond that. So as far as day-to-day functioning would be limited, and their healthy outcomes are not great as they're just meeting those basic needs. One thing I found interesting is that they said that just lack of really healthy food or consistent food can lead to many diseases like heart disease and diabetes, and so that could affect how well they can continue. So some of the specific concerns with communicable diseases or infections, they actually did research that found that they have a higher risk of urinary tract infections and skin infections. And because of the frequent alcohol and drug use, that can put them at a higher risk for sexually transmitted infections due to high risk behaviors. And then anything like flu, or they don't frequently get vaccinations as they don't have great access to healthcare. So anything that they need a vaccine for, that's going to put them at a higher risk for developing one of those conditions as well. And then some of the other diseases that are really common, some of these I expected and some were a little bit different, is that substance use disorder, anxiety, depression, insomnia. A lot of times those just go hand in hand with trauma and not being able to sleep because of the flashbacks and the nightmares. But they are at risk for type 2 diabetes and heart disease, and they related that in research to the fact that they don't have great access to healthy food on a consistent basis. And then also a lot of respiratory conditions due to just not getting great health care and not being exposed to a lot of things that could prevent that. And so our main concerns for them is self-care and self-harm. With self-care, it would be important to teach them about and give them interventions on how to get adequate sleep. To working through some of that trauma could help them, because that's just going to add to that. And then just adequate nutrition that can limit some of those other diseases that they're at risk for. One of the biggest concern is going to be self-harm. The suicide rate is much higher in this group, and substance abuse, because that's a problem, they can have accidental suicide as well, or they can have intentional as well with that. So some of the other concerns is they are at a higher risk of violent acts. It's usually due to the flashbacks and nightmares, reliving that event and not understanding where they're at, especially the combat ones. But they also are at risk of being harmed by others. Many of the traumas are intimate partner violence. They found that a lot of times they'll go back to their partner and they can be damaged there, as well as just people not understanding what they're experiencing and their flashbacks, and that can lead to violence, mostly violence because of not understanding them. Here is my reference page.